Is This Normal, Doc? A podcast sponsored by Tanner Clinic.
Welcome back to another episode of Is This Normal, Doc? The podcast where we talk about what's normal and what's not with the expertise of our Tanner Clinic providers. I'm Hope, and I am your host, and Tara will be my co-host today. We're going to be talking about culinary medicine, which is something I don't know very much about, so I'm excited.
Today we have Dr. Richmond Doxey here from our internal medicine department. Thank you for coming. Tell us a little bit more about yourself.
Well, thank you for having me on this podcast.
Yeah, we're excited. We're excited to have you.
So my name is Richmond Doxey. I went to medical school in Wisconsin and then did residency training in internal medicine in Boise, Idaho. And during my residency training, I learned about a subspecialty certification called Culinary Medicine. And so I did a rotation with the group that started it. This was about 10 years ago. And loved what I learned. And I went down and did a hands-on rotation where I learned how to cook, teach people about food, learned about food's impact on health, and it was phenomenal. And so I have incorporated that into my medical career ever since.
I love this. I'm so excited.
Yeah, I'm excited. I'd never heard of culinary medicine before this. So I'm going to learn so much new stuff today. We're going to get started with our segment that we like to call, Is This Doc Normal? Our first question for you and for everyone is, who is your favorite fictional doctor?
You know, I'd have to say Dr. Watson from the Sherlock Holmes series written by Arthur Conan Doyle.
Yes.
He kind of is the thread through all the mysteries, and yeah, he has a pretty keen mind. Not quite like Sherlock Holmes, but close.
Yeah, he can keep up with them for
He
sure.
can, for sure.
It's a great choice.
Yeah.
I love that choice.
I would have never thought of that choice either.
All right. Tell us what your favorite food is.
Favorite food would be fresh berries.
Specific one?
Anything in season, or right off the vine. Nothing quite like a blackberry in the late summer right off the vine.
Yeah, but Northern Idaho,
Yeah.
they have some good ones up there.
Mhm.
Or Montana.
Indeed. Or Montana.
The huckleberry season.
Yep. Or fresh strawberries, whatever it is. Yep.
When you cook, are you more follow the recipe or are you just more go with the flow?
Very much a go with the flow. Now, having said that, learning a lot about culinary skills and cooking, I couldn't have done that as well 10 years ago as I can now. But now that I understand principles, I just look at a recipe or a couple of recipes and I make what I want.
I feel like it just comes with like being comfortable in the kitchen.
Yeah.
And if you've been doing it long enough, then you're probably, you are more inclined to.
And
not
what I
just go
have
for it.
is what determines what gets made. Like,
Yeah.
if I don't have it, then I just substitute it or make something else.
That's a skill I wish I had more of. But
More practice. It took him 10 years.
I know.
there you
I
go.
guess I
It's
just
a long
gotta-
time.
Yeah.
Yeah.
Would you rather always be stuck behind the slowest person or always have the shopping cart with a squeaky wheel?
I take the squeaky wheel.
I feel
I
like,
hate both of those, but I think
For sure.
I would agree with you.
but also I think if you're like in a noisy enough store, you're not going to notice that as much.
Right.
Plus,
Right.
they all have a squeaky wheel.
Most of them
at
do.
some point if they're old enough.
Yep.
And you get in and out very quickly. It just makes you go faster. You probably spend less money.
Exactly.
There you go.
Exactly. Yep.
Budget saving tips.
Yep.
Yeah,
Get the
I'm
shopping
not going to go
cart.
all the way to the end of the store.
Pick the squeaky shopping cart.
Get it.
Okay, so I have concluded that you are normal. I wanted to put you on the edge there, but nothing that you said really was a red flag to me.
Thank you.
I feel like you're a pretty chill guy. So unless you gave me like a super strange answer, I feel like, you're pretty normal.
Good.
I really want to tell someone they're not normal, but everyone's been pretty normal so far. So
That's what we get
it's a
here.
disappointment. I need more people to be weird. Getting into today's topic of culinary medicine,
Yeah.
can you start off with what is culinary medicine?
So John LaPuma, he's a physician, has done a lot of teaching and publishing about culinary medicine. And several years ago, he defined it as a practical discipline that is unconcerned with the theoretical or hypothetical case. Instead, it addresses the patient in immediate need who's asking the question, what do I eat for my condition? So it's not nutrition, it's not medicine. It is saying, here's the food, here are the culinary techniques, here's the practical application so that you can take what we've talked about and make it work.
So what does it look like when you are practicing culinary medicine, I guess?
So let me give you an example. One would be heart failure. So a patient walks in with heart failure, usually because the heart isn't squeezing very well, has a hard time handling fluid.
Okay.
And the standard advice is to follow a low sodium diet.
Yeah.
And we'll say that, and it works. Following a low sodium diet absolutely works. But if the patient walks out with that piece of advice, eat a low sodium diet, it, first of all, doesn't address the whole picture. And second of all, it's a little bit nebulous. So he'll go to the store, he'll look at Campbell's soup options and find a low sodium tomato soup and kind of grin and bear it, and it's miserable. But if we can say, hey, you have heart failure, one of the pieces of that is to follow a low sodium diet, but here's the rest of the puzzle.
Yeah.
Here's how to flavor your food. Here are dishes that work in heart failure. Oh, and by the way, here are the other micronutrients that your heart needs in order to function optimally. Copper, zinc, magnesium, potassium, iron. And we can say, and here are the foods that are rich in those nutrients. Here are the foods, here are the recipes, or here's some ideas of what you can do to make that actually happen.
Yeah.
And here's how you make it taste good and enjoyable.
I know someone who was told to eat a low sodium diet, and it's been so miserable. So I can only imagine for someone who's been given that diagnosis and also been told this, like, you have this very restrictive diet that you have to follow, like how helpful that would be to have all that information instead of just low sodium.
All right, so you talked about heart failure. What other conditions can you use cooking for to improve your diet?
I've read about a lot of conditions, and I have not encountered a single chronic condition or disease for which diet doesn't help. And that ranges the gamut from asthma and allergies to reflux to irritable bowel syndrome. Chronic pain is improved with dietary changes. Really almost anything you can think of, even like your risk for clotting, improves dietary changes. Anxiety and depression. There have been a couple of randomized controlled trials looking at different diets for anxiety and depression, and the Mediterranean diet lessens anxiety, lessens depression, improves outcomes.
And it's delicious.
And it's very tasty.
It is.
Yes.
I just go on that one for fun.
If a patient comes to see you, how do you go about helping them make these dietary changes?
So first thing we do is we assess and see where the patients are.
Yeah.
I'm going to look at a few things. I'll look at the patient's current conditions and both as what is most concerning to me as well as what is most pressing to the patient, and kind of take both those into consideration. I will take a dietary history and say, what are you actually eating right now? What does a typical day look like for you? Or what did you have yesterday for breakfast, lunch, for dinner?
Yeah.
And then once I understand that, and also take into context their socioeconomic status, their cultural preferences, and a lot of that comes into play when I see what they're actually eating on a regular basis, then I say, okay, so here's where we are, and here's the pattern that will best help this disease, continue with heart failure. Here's the pattern of a low sodium diet that is rich in fruits and vegetables and whole grains and legumes, and how, from what we've talked about, what are some ways you could add, say, more fresh fruit into your diet?
Yeah.
And maybe I'll give them some ideas, and then patients say, well, okay, well, maybe I could add an apple with lunch, or maybe I could put avocado slices on my sandwich.
Yeah.
And once we have brainstormed some ideas, then I say, okay, pick one, maybe two things you're going to change. And patients are coming to do this, and I say, okay, so then I clarify the goal and say you're going to eat avocado with one meal a day for the next 2 weeks.
Yeah.
And the patient says, sure. And I say, okay, that's the goal. And then I'll follow up with you. And that's the process.
I'm starting to understand more your Dr. Watson, because this is feeling like medicine, but it also feels like you're kind of like a detective. You're like taking their like preferences, and then you're taking their diagnosis, and you're like trying to work with all these different factors to kind of like make the perfect plan for them. I just just came to my head as you were saying all that stuff. I was like, that's perfect. That was a perfect doctor for you. So
Solving the mystery.
solving the mystery.
Love it. So we heard you do something called shared medical appointments. Can you tell us more what that entails?
Yes. So our shared medical appointments are appointments in which patients come together in a group. And for a typical shared medical appointment, patients will come, we'll talk about a shared common disease condition and ways to improve it. And then patients go home and have learned something from the doctor or the dietitian or whomever, and from the peers. We level this up and we say, okay, we're not just going to talk about heart failure or diabetes. We're going to show you how to help with food. And so we have tables set up with burners and cutting boards and knives and skillets and a recipe, and then led by either a physician or dietitian or kind of a team. I usually do this in a team. We then cook a recipe together. And every patient has the recipe, and every patient has all the food. Every patient is cooking the recipe step by step. And in the end, patients walk away with a satisfied belly, with a recipe, and with culinary skills.
Yeah.
It's pretty intimidating to just eat more fruits and vegetables. And you go home, you buy some produce, and set it on the counter, and you've got a pineapple staring you in the face. Like, I've never even cut a pineapple. What do I do with this? But having the skills, here's how you hold a knife. Here's how you hold your other hand. Here's how you cut a pineapple. Completely empowers a patient to take control of their health with food.
There's that one show where the people are like so inexperienced at cooking and they like do cooking challenges. One person like forgot to take the cover off the knife. Someone tried to cut through a full avocado, including the pit. So yeah, I think for those people, it would have been very helpful to do one of these shared appointments. So.
And you'll be doing those classes coming soon here at Tanner Clinic. So will be
more to come.
Yeah. More information later on that.
Yeah.
Yep.
Hopefully by the time this comes out, right?
That's right.
Yeah. So I think a lot of people assume that eating healthy is very expensive. What is your opinion on eating healthy versus like eating out at cheap places like fast food for someone's budget if they're really budget conscious?
I've looked into this and have both thought about this as well as looked at the data, large research databases, published papers, and the data clearly shows that eating whole foods is cheaper, significantly cheaper than eating out, even at a cheap fast food place. Okay. I mean, just do the math really quickly. So let's say, the dollar menu is no longer a dollar menu, right? It's like $1.30.
Yeah.
And so you feed a family of 6 or so, and you're spending about $15 for a meal, $12 to $15 to feed the family for one meal.
Yeah.
If you do that 3 times, that's $45 in a day. And over the course of 30 days, that's well over $2,000 in a month if you're just eating out of fast food. Yeah. That is way more than my current family food budget. If you take a fast food meal and you sit it side by side with something very simple like homemade stir fry, brown rice, and like a nice sauce, and maybe even have some fruit for dessert, it's probably 60 to 50% the price of enough fast food to feed a family of 6. And you usually have leftovers.
Yeah. And that's the thing, like the ingredients I feel like stretch further too. Because if you get fast food, like it really is only good one day. Let's be honest. Like McDonald's fries, have you ever tried those? The second day, it's not good.
Not very good.
Okay, like an hour later.
Yes, exactly. As soon as they get cold. They're like amazing when they're warm, but then they get cold and you're like, never mind. Actually,
reheated, not very good. Yeah. If you're measuring calories are often cheaper if they're processed. But really, we don't eat calories, we eat food. Yeah. And so if you're looking at food, at volume, at meals, it's way cheaper to make your own food. And in most cases, patients don't need more calories. They need more nutrient-dense food.
So another issue people may run into is just time. So how can they incorporate this lifestyle of like actually cooking your food into this change?
Yeah, that's a great question. Certainly with a busy schedule, it does take time. And especially when you first start, it takes a little more time. There's that investment there. But over time, and the research again supports this, as you practice, then the time gets shorter and shorter. Another way to look at it, and this is depending on, I guess it's a little bit different now in the age of DoorDash, but the time it takes to drive to the restaurant, pick up the meal, come home, eat it, and then put it away. It's similar to making a fairly simple meal, especially one that you've practiced and you have the ingredients on hand.
Right.
It doesn't take that much more time, and it's way cheaper, and in most cases much better for you. There are also other hacks. Frozen veggies, love frozen veggies. I have my freezer stocked with frozen vegetables. You can use pre-cut carrots, for example, julienne carrots, and use those. There are ways to buy some convenience packaged foods that aren't heavily processed that will significantly cut the time. The other key thing, cook in batches. Rarely do I make something that has a single serving that I'm only going to eat that day. I either make a batch of it and I eat leftovers, or I chop more than one thing so that I have it so that I can use it in my meal the next day.
That's literally, I was just going to say, like, if you have like a day where you're less busy, that could be like your prep day maybe, like cut things then, or like meal prep your veggies.
Or if you're already cutting a carrot for a soup, cut some carrot sticks and put them in the fridge. Yeah. If you're already doing it, just do a little bit extra and then you have stuff to use.
Exactly.
That requires a lot of planning.
It does.
With some of us that have ADHD, it doesn't usually.
It does require some forethought.
I will say that I'm not good at the planning part. I don't mind the cooking, but getting like those like Green Chef or those type of meals where it comes with all the ingredients, that actually helped me cook at home more.
Yeah,
Probably
totally.
I don't know about the cost, but anyway, that's a little ADHD hack.
Yeah, and you can use it for a while to kind of get some ideas of recipes, and then you have to keep using the service.
That's what I did too. I like got it, and then I have all these like recipe cards now, so it's like it is a little bit easier for my brain to like pick a meal that I want.
You've got the shopping list, you've got the recipe card, you've got the stuff you need. Yeah.
Within the realm of culinary medicine, are you just working with someone's diet, or do you also prescribe medications? How does that work?
Medications and diet really dovetail, and used together, they provide a powerful combination at treating a disease. A couple of examples. One example is hypertension. If patient's blood pressure is high enough, we need to treat it. It reduces risk for heart attack, reduces risk for stroke, protects your kidneys. You need to bring the blood pressure down.
Yeah.
However, food, and the DASH trial and many other trials have shown this is very, very effective. Food brings blood pressure down as well.
Okay.
Turns out if you make big enough changes, the time it takes blood pressure medication to work is the same as the time it takes a dietary change to work, 2 weeks. But most patients don't make big enough changes to see that quite of a rapid decrease.
Yeah.
So I say, well, let's start a medication or let's increase your medication. But guess what? Here's what else you can do. You can start increasing fruit intake, eating more vegetables, making more intact whole grains, eating more legumes, using more herbs and spices instead of sodium to flavor your food. And so what I'll see is blood pressure comes down. And once it gets low enough, then we say, great, let's pull back your medications. And blood pressure will stay low as long as patients are still eating healthfully.
Yeah.
And they don't need to go up on their medications. And I use this approach for many other conditions, diabetes, heart failure. I'm not going to pull patients off heart failure medications. But in many conditions, we can, it's kind of a balance. You can go back and forth and use both, but they both work very well together.
That's good to know that it's kind of like a balancing thing for a lot of situations. Like I have an autoimmune disease, so the idea of like pulling me off one of my medications really scares me because I know how I felt when I wasn't taking them. So I can imagine people would want to work with their medications rather than just like fully be taken off of them.
Yeah, and in some cases, you just continue the medication, but you layer the dietary changes on top, and the outcomes are remarkable.
So what do you tell patients when they come in and say, what diet is right for me?
I will first, like I said in the beginning, assess, what conditions do they have, how are they currently eating, and then we come up with a plan that works for them. I have several resources that I point patients to, because there's a lot of conflicting data all over the internet, and it often seems like, 1 week this is the best diet, 1 week this is the best diet, and so I point them to some reliable, reputable sources, including websites from universities and other well-credentialed individuals that aren't selling something or aren't really trying to promote one specific program. So some of my favorite resources are Harvard T.H. Chan School for Public Health and their website. They have recipes, they have a lot of information, a blog. Another really good resource and podcast is Michael Greger's Nutrition Facts. He doesn't make any money off of it. He's not really selling anything. He's just compiling all the data with his team and then disseminating it. My go-tos for recipes online are oldwayspt.org. If you just Google Old Ways, it'll come right up. Excellent recipes, very simple, very fast, and usually with ingredients that people have on hand or that are in the grocery store. And then the other one that I more recently have discovered and I've been using more is the Blue Zones website. And there's the Blue Zones cookbook that I've been using. There's some fun recipes, a little different than the standard American fare, not quite as adapted to American taste, but I've really enjoyed it. It's been fun to branch out a little bit.
They have longer lives than these Blue Zones.
I know.
Yes,
I'm very interested in the Blue Zones. I'm not gonna lie.
Yeah, and more healthy lives.
Longevity and less comorbidities.
Exactly.
Yeah, it's very interesting to see like the things that they've studied about them and the specific changes. Like they don't necessarily like go to the gym, but they like walk everywhere they go, and they're like steady with their like exercise. Like they have a more active lifestyle, but they're not like going crazy with working out and. Just, I don't know. It's very interesting to me. But the Blue Zones.
Yeah, and that brings up a really good point that, while nutrition is really foundational in making lifestyle change and in having a more healthful life, it really isn't in isolation. Other pillars of lifestyle medicine really have to come into play, including physical activity, restorative sleep, social connection, avoiding risky substances. And all of these things really can make a big difference and come together synergistically to have someone live a very healthy and full life.
Yeah. This is kind of a general question, but how would you change conversation around diet culture?
I've actually thought a lot about this as I counsel patients and information comes. I think that the message that I try to tell my patients and really reinforce is that we eat food. It sounds really simple. It sounds very obvious.
I was like waiting for you to continue. I'm like,
yes, but that's really it. And so as we talk about dietary changes, when I converse with patients in terms of food, in terms of, and talk about the research that has studied the food, for example, there's a study that shows that eating 2 cups of beans per week in men reduces the risk of colorectal cancer by 22%. Wow. That's pretty compelling.
That's huge.
And it's very inexpensive. But we're talking about a concrete, food. I'm not just saying, eat more fiber or reduce your sodium, but I'm saying here's something you can actually do. Eat beans, whatever beans you like, black beans, pinto beans, garbanzo beans, twice a week, or 2 cups per week, so however you want to split that, and your risk for colon cancer drops by 22%.
So Cafe Rio twice a week.
Right?
No eating now. Okay, make it at home. The Cafe Rio.
Make it.
If you do eat out, get a side of beans. If you eat out, get a side of vegetables.
Yeah.
Increase that. But again, so patients can think, oh, that makes sense. I can use that, and it's very directly applicable. Another good example is patients will say, well, I'm just avoiding carbs, and I say, okay, well, tell me more. What do you mean by that? And in most cases, patients mean they're avoiding pastries and sweets, which incidentally are high fat and high carbohydrate. If they put carbs in one bucket, then patients are often avoiding fruit, maybe even avoiding some vegetables, avoiding intact whole grains. I was just looking at a study comparing refined grains to whole grains, and turns out if you eat intact whole grains, think like brown rice, quinoa, you absorb fewer calories, resting metabolic rate goes up, blood sugar control is way better compared to those eating refined grains. They're both carbs, but if we talk in terms of food and say eat brown rice, eat quinoa, and let's avoid the cupcakes and limit pastries.
And I was like, avoid happiness.
And the changes happen.
Yeah.
And it cuts through a lot of the confusion, a lot of the seemingly conflicting data. When you take a step back and look at the data as a whole, especially if you look at the data that has studied foods specifically and then dietary patterns like the Mediterranean diet, things clarify. And there isn't as much conflict as the media sometimes portrays.
Yeah. I think I tend to get overwhelmed sometimes just because I think about all the like additives that are in foods. And so I'm like, it's not even worth it. Even the healthy stuff's not good. But I'm like, that's not true.
No, not at all.
There's still nutrients in the foods that we can get. But I just, for some reason, it just feels like in America, our food is just bad.
Well, and that also speaks to the point that this is incremental.
Yeah.
Not very often do I see a patient make a wholesale change in how they're eating. I've seen it a couple times, but usually it's in patients who were eating that way before and they're just getting back to what they were doing before.
Yeah.
But in a case where patients are trying to make changes, it's one step in the right direction, a couple steps back. You make another step forward, a couple steps back. And over time, this starts to build.
Yeah.
And patients like, I can do this and I'm feeling better. And I'm seeing results. But it takes that persistent effort and just layering changes one at a time. And it's okay if you mess up. Just keep going. It's not a big deal. And it works. It's magic. It's so cool. And it's my favorite part of my job is to see patients make these changes and come back and say, it worked, Dr. Dox. I'm like, yeah, it does work. Isn't that cool? You're doing it. It's not me, it's you.
And you're fueling your body with the right things.
Yeah.
I can imagine that. I mean, not that I would know. Just kidding. I gotta come do this so that I can tell them firsthand what those changes are. But
that's right. I really love pastries. But anyway. Okay, so I feel like you practice what you preach. Have you yourself seen any changes in changing your lifestyle?
Yes, absolutely. And I'm always evaluating and changing and modifying within the principles that I talk about. But I don't advise my patients to do anything that I either don't do myself or I'm not willing to do myself. I have followed a FODMAPs diet. It's to support a patient. I have followed what's called the specific carbohydrate diet. I have followed intermittent fasting. I've done a lot of these things, partly to understand what my patients are doing, partly to understand the kind of just my own physiology. And it's been remarkable. I have more energy. I don't get sore. So like, for example, last night I was rock climbing with a youth group. I thought for sure my forearms would just be killing me. They feel fine. And ever since I have switched to eating a whole food, plant predominant diet, I'm rarely sore after I work out. Even if I'm not that conditioned in that particular area, like my forearms, for example. I have more energy. I just feel good. I feel light. I feel like I can do what I need to do.
I was thinking I'd have to work out to feel sore, but...
Well, thank you so much for coming on here. I think I can speak for both me and Tara when I say we learned a lot. And it actually is really nice to hear that people are seeing real changes from this and that you can personally say that you've seen changes from it. It's something that we have not had here before, and I've never heard of culinary medicine. So it's this cool thing that is like lifestyle mixed with like medicine. I have a feeling there's going to be a high interest in it. Do you want to let people know how they can, come and make an appointment with you?
Yeah, so you can call the Tanner Clinic line. You can get online and schedule an appointment to see me. And then regarding the shared medical visits that we talked about, that we're still working out how to get that all set up, but more to come. And there will be posts and you'll find ways to do that. I think once in the call center, we'll have ideas of how to get that scheduled once that's arranged. So.
I'm excited to get that started.
I know.
Cooking class.
Look out on our social
with
media,
real food.
on the website, we'll have more information hopefully to come. So thank you so much for coming on. We are so grateful for you taking your time out of your day to come and talk with us. So stay tuned for our next episode. It'll be really interesting. So if you have any questions for our next provider, put them on our social media. We'll put out a prompt for you, and we will see you next time.
Is This Normal, Doc? A podcast sponsored by Tanner Clinic. General informational purposes only and should not be considered medical advice. While our podcast will provide helpful suggestions and insights, every individual's health situation is unique. For specific medical advice, diagnosis, or treatment, please contact your personal health care provider.